All right, afternoon, everybody. I'm Matthew Holt. I'm the founder and publisher of the Healthcare blog, and have another THCB gang back together. We've had a fun, chaotic start, but we're going to get going. Great lineup this afternoon. We have a good mix of feisty patients, consumer advocates, healthcare analysts, and interesting, independent thinking doctors. All right, so who I got on the show today? Jeff Goldsmith, veteran health futurist from Health Futures Inc. in Charlottesville, Virginia. Lygeia Ricciardi, consumer advocate, and these days CTO at startup Carium from DC. Casey Quinlan from Richmond, Virginia, Mighty Casey Media, and also the host of the Healthcare is Hilarious podcast, who's having quite a fun time with the healthcare system, not at the moment. And then two regular physician contributors to THCB, Saurabh Jha, radiologist from Philadelphia, and Anish Koka, cardiologist, also from Philadelphia. So we're going to go live now. And we're all on, although sorry, Anish's camera is off. So Anish, switch your camera back on. All right, we're going. So we're going to start the way we always start, which is going to go around the group and ask them what they've seen in the last week or two. It's been a while since we've had actually Casey, because she's been having some health issues, and Saurabh and Anish on the show. And for that little, Lygeia hasn't been on that often. So Jeff, it's kind of you and me are always the only regulars now. But let's start with you, Lygeia. What have you been saying?
All right, so I want to start with positives because it's important to throw some positives in, although I have some negatives too. On the plus side, I really feel like we're starting to turn the corner on COVID. I'm feeling much more optimistic. Many people that I know and that I was worried about are vaccinated. It looks like, we've got this huge relief bill passed. We are going to make it through. Not that we're there yet, but thank goodness. On the downside, I'm feeling kind of depressed about these recent Atlanta shootings, even though you might not technically classify them as a healthcare issue. You could arguably say that guns and shootings are health related. And ultimately, I just think it's symptomatic of a sickness, if you will, that our country has in terms of our general, violence and isms of various kinds, xenophobia, racism, sexism. So that is definitely has me down. But on the positive side, big picture, at least we're coming through the dark winter of COVID.
Yeah, worth noting that the one article that got the most comments ever on the healthcare blog, like 500 comments, was about gun safety. I think the NRA got it on their mailing list.
Oh.
Got completely out of control.
Yeah.
Very interesting. All right, Casey. I don't know what you want to tell us a bit about your own, how you've been doing recently.
Well, I mean, let's just say I've had the front row seat since October. But it was something, it's like I went over an Outer Banks dune both ways because on my 68th birthday last August. And since then, life has been interesting. It's like I had pain the next morning. I realized I'd wrenched myself. And, I tried, my usual stuff. And, I've been through this whole thing. Everything has made it worse. Everything from PT to, finding a COVID safe gym again. I did with a pool. It was great, but swimming made it worse. And since then I've been through, ortho. Now I'm in oncology. Thank you. Incidentalomas on MRI findings reports. I am a very unhappy person about that but all right, I'm not an idiot. So I'm getting worked up for stuff, but that's more on the negative side. And that's just personal to me, but I now have lots of empathy for people who have to use mobility aids because I can barely walk. I mean, I have to use a walker in the house. So there's that. Anyway, but on the plus side, and there's a couple of plus sides here, I share Lygeia's positivity about the hope that we might be coming out of the woods on COVID. I also will not confess, I myself am a gun owner because I'm a deer hunter, deer and turkey and bear. But I totally am behind 110,000% behind federal gun checks, waiting periods. It's like I don't want people to go in this state they can and basically buy a gun and walk out with enough ammo to take out a small village and pick a country. And so I'm one of those who likes to think of herself as an a responsible gun owner and am not a member of the NRA. I hate them. And who knew that as much as I dislike Judy Faulkner and her crowd, that I would find that my chart was actually useful. I mean, in this, excuse me, frog in my throat. In this instance, being able to look across my chart, because both the ortho crew and the oncology crew use Epic, different systems, but they use Epic. I've been able to track stuff and go, no, that's not right. This is the most recent one. Or you even just know where I'm supposed to be next. So there's that. But you know, right now my world is very small, which is why now that I can move a little more and actually sit at the desk for longer than 10 minutes at a time, thank you, oxycodone, I am able to participate with us today. I'll hand it off now. Thank you.
Thanks. Well, I'm glad to hear you're getting better, even though through pharmaceutical help. You can, of course.
Nobody has done anything for my back yet. Now they're all over the rest of my corpus, but they haven't done anything about my back. No treatment for my back yet. So still waiting.
You can, of course, hold up your MRI to the camera, and Saurabh will give you a quick read to tell you whether.
No, I don't have the DICOM for that. Sorry.
All right. Well, let's go to Saurabh. Let's go to you for what you've been seeing the last week or so.
Yeah, let me start off with the negatives, and then I'll go to the more negative. I just recovered from that horrendous interview of Harry and his wife with Oprah Winfrey. That really pushed me back a few years, I have to say. That was the most horrendous, whiny, overprivileged, overpampered media interview of two people that could not be more talentless and mediocre than if they... Now that I've got that off my
So
chest.
I did well to avoid it, is what you're saying? I haven't paid taxes there for 30 years. You haven't paid taxes there for 15 or so.
You know what the WHO says about health, it's a state of, it's not just about not having disease, it's a state of total well-being. I was unhealthy after watching that interview.
You know, you can turn it off.
Yeah, well, yeah, not to mine.
Apparently you couldn't.
I didn't watch it.
I
saw about half, and that was enough.
I heard way too much about it for you know. I'm always in the question of, you know, I like the Australians who said we'll keep the monarchy when they had given the choice in a referendum because some other idiots, i.e. the Brits, are paying for it, and then we don't have to pay for our own presidency. I was trying to figure out which one costs more. Anyway. All right. Non-Meghan and Harry part of the
comment. Europe's idiotic reaction to the blood clots. And it's a big problem with vaccines because every day there are a bunch of people that are going to die. It reminds me of the, there was one match between India and Pakistan in which Pakistan beat India in cricket. And somebody had a heart attack and they said, well, it was because Pakistan beat India in cricket. But there are about thousands of people that are going to have heart attacks any day, right? You can't keep putting causal inferences on things like this. And this is a big problem. And the way Europe overreacted makes me even think for a second that, you know, Britain did the right thing with this Brexit, because you've got this whole body of people that they don't pool their intelligence. It's not as if they're building on each other's intelligence. They build on each other's stupidity. And this is a very great example of building on each other's stupidity. How many days were lost because of the vaccine? Firstly, the vaccine got delayed because of the political process, because it couldn't be put out before the elections. That too, you know, that was a criminal, near criminal event. And then on top of that, it's getting delayed because things like this. It really is. And these are all avoidable deaths. These are all people that could get the vaccination and aren't. So that was a negative. And even though the regulatory agency told them not to fret about things, but the Italians will do what they want, the Germans will do what they want, and the French will do what they want, which puts the whole European experiment again into disarray and makes a mockery out of it.
Yeah, I mean, interesting that. I also noticed that Boris Johnson today said he was going to get the vaccine, get the AstraZeneca vaccine, which is actually quite interesting. I would have thought that he'd already had it, because if you look at the US, I mean, and we'll get into this later.
Well, he had COVID. He had COVID, right?
He had COVID, so I guess. But you know, Trump had COVID, and he got it in January. He got one of the Moderna, whichever got Moderna or Pfizer. And it's also worth noting that I saw that 25% of members of Congress, members of the House, I'm not sure of the Senate, haven't had it. And we should probably get into what's going to have to happen when we open up, and what access to what public buildings and public spaces is going to be available to people who haven't had it voluntarily. I thought this might be the way to fix for the Democrats to fix the filibuster. But anyway, Anish, can you stick your mic on? And good to see you back. It's been a while since we've had you on here. What have you been? What trouble have you been causing? What have you been looking at the last few weeks?
Well, I've been trying desperately to get my hands on the vaccine. I have a clinic in Philadelphia, and I've been trying to get the vaccine allocated to us. I missed a little bit of the initial part, so I apologize. But the United States federal government has already paid for the vaccine, right? So the vaccine is free to every American, to get. But I guess when you make things free like that, then somebody has to be in charge of doling out this free thing. And you already have it. It's unfortunate because we already have this massive mechanism that's already built into getting vaccines out. You have primary care offices that dot the landscape where, the flu vaccine, the pneumovax, whatever vaccine comes out, we order it. We tell people, hey, we have the vaccine, and we give it out. This has been a very, very, very different process because it is controlled by the Department of Health, who has vaccine, and then they control giving the vaccine out. So you can imagine
in 50 states, there are 50 distribution channels in this country. That's why we're having a problem.
Yeah.
Right. So, right. Yeah, no, I don't quite, I guess I don't quite understand because I guess, whatever. I guess you're right. So there's all these departments of health that I guess are assigned this vaccine, and they have to run around allocating it to people. And there's just a tremendous amount of regulatory work or, red tape that suddenly happens. Like the moment we could apply for it, which was in March, in December, mid-December, we applied for it. I didn't hear a single thing, and we sent multiple emails saying, "Hey, what's going on? We have a lot of people that want the vaccine. Can we please, have it?" And finally, there's some webinar a month or so ago, and I got on a chat there and said, "Hey, this is Koka Cardiology. We're a clinic in Philadelphia. We'd love to get a vaccine. Please, can you look what's happening with our application?" And then the next day, I finally got something, and we finally started moving on. So it's almost. I don't know for sure, but I'm sure the poor Department of Health, they're all well-meaning, nice people, but I'm sure they've been deluged by masses of clinics who have been trying to kind of, who've been, and I guess, you can't get to all the applications, but, so it's interesting that because it's free, you have this type of thing happening because they're using a city program that is for giving out free vaccines to people that don't have insurance, right? And so that it's much ballyhooed, the number of folks that don't have insurance, but that number is a relatively small number, relatively speaking. Now you have that small group in the Department of Health that manages free vaccines that now is in charge of giving vaccines out to 5 million Philadelphians, which is I'm sure they're overwhelmed by, and probably wasn't the smartest thing to do. Like, if the feds own it because they bought the vaccine, then you probably want the military running around with everything the military can do in terms of giving out vaccines. I think but instead you have this kind of hybrid model that explains why we have not been as good as we could be in giving out the vaccine. I think we could have been a lot better in giving out the vaccine, even barring issues with vaccine hesitancy that exists in, unfortunately, too much of the population. So I have just been allowed to order the vaccine as of yesterday. And so I've ordered the vaccine, and I hope by Friday at noon, we're supposed to check the website and we'll be told about allocations. Then after that, once we get the vaccine shipped to us, hopefully next week, every day we are supposed to report to 2 separate websites about the number of vaccines we have on hand. So, again, you can see why there's a lot of primary care docs that I know, a lot of clinics that I know that are just like, forget this. We're not doing this because, by the way, we're not getting paid. We're not really getting paid. It's not that I'm asking for payment. It's just that, this is a lot of work to do and to continue to do. you know, it seems like a system that could probably be better.
Right. Well, let's we'll go to Jeff, and then we'll dive. I think we'll come back and dive into that. But Jeff, what have you been up to that we're seeing the last couple of weeks?
Well, I'm in the rare position in this all East Coast panel that you've accidentally assembled of being the most optimistic person in the panel. I mean, think about the last time that happened. I have been extremely anxious about the economic backlash for our healthcare system from this pandemic. It wasn't a recession that we had beginning in March of 2020. It was a flash depression. The day before it started, there were more job openings in the American economy than there were unemployed people. 3 weeks after it happened, there were 20-some odd million newly uninsured or newly unemployed people. And we've still got about 9 million of those folks that don't have jobs. So it's not like we're not out, it's not like we're out of the woods. What worried me was, and I wrote a piece for Healthcare Financial Management Journal about this 4 or 5 months ago, was there's typically an 18-month lag between the onset of an economic problem and a significant deterioration in the healthcare financing system. And there's a pattern. If you look back over the last 5 recessions, you see a spike in uninsured people and businesses shutting down and throwing people off their employer-based benefits. You see a rise in Medicaid and a state financial crisis that results in more Medicaid people, but less money to pay for the care. So there's been a pattern of 18 months after a significant onset of like what we saw last March of really hardcore economic stress being placed on the healthcare system. Well, thanks to the American Recovery Act, and thanks to as well a lot of employers that were not willing to throw frightened, anxious workers into the ranks of the uninsured, we have seen an increase in Medicaid, somewhere between 9 and 10% increase in Medicaid, but Medicaid is still coverage. It's still an opportunity for people to get care if they need it, but a very small increase in the number of uninsured. And then we get the American Recovery Act, which plugged a whole bunch of holes that were there in the Affordable Care Act a decade ago, but that worsened during the Trump administration. And also, the logistical hassles associated with getting coverage increased because Trump basically riffed the entire nucleus of navigators that were helping people navigate the completely user-unfriendly website that was thrown up there 10 years ago. Well, we've seen a significant increase in state match for Medicaid. They were talking about 6. I think they ended up with 10, which is just shocking. They significantly increased the subsidies for people to get covered under the exchanges. They capped out-of-pocket costs so that people, particularly at the high end of the income spectrum, don't have to lay out, an unaffordable amount of money to get coverage. So I think the net effect of all of this is going to be that we will actually increase the number of insured people, not decrease it. So I just think we were sort of whistling past the graveyard here, wondering when the hammer was going to come down on our care system and financing. And I think a combination of employers actually trying to extend coverage where they were able, people getting forgiveness from debts and things that would make it hard for them to pay for care, and then a very significant increase in accessibility of the benefits that were created under the Affordable Care Act. This is a way better outcome than I think any of us congenital pessimists could have hoped for.
All right. Well, I think that's interesting. We've got that sort of macro thing going on in the background with the Affordable Care, and honestly, there was a terrible, as you said, flash depression, but we recovered out of it quickly. One area that, by the way,
just one more thing. I mean, is that we at the very end of Trump, we'd crept back to 31 million uninsured people.
Right.
And I think the changes that have taken place in the Affordable Care Act will push it back down into the high 20s, the mid to high 20s. I think we'll get
and we'll have to
as
see
many
what
as 4 million or 4.5 million newly covered people out of the American Recovery Act.
But we'll also have to see what happens in Texas and Florida and elsewhere about Medicaid expansion and sort of.
They're not going to do it.
Well,
It's not going to make any difference. They're not going to do it.
All right. Okay. My thing for the week, while this has been going on in the world of digital health, and I'm sure Lygeia, you've been looking at this. This was the week I've seen the most massive funding rounds, sort of several, $150, $200 million funding rounds. I do this little show, Health in 2.0 with Jessica. We do we cover 3 or 4 or 5, in a 2-minute wrap. And there were these days, this week, if you didn't raise more than $75 million, you couldn't get a new spot on the show. So we're really seeing that whether influenced by the Recovery Act, which is going to happen anyway, the stock market, continues to go dramatically. And I heard Mark Andreessen on a Clubhouse thing talking about that there is $15 trillion of money in the world that is being parked at negative interest rates in government bonds and looking for somewhere to go. So we still have this massive liquidity. And just this morning, this week, we had a couple of new companies, well, relatively new companies, but Doctors on Demand, which is a telehealth company, and Grand Rounds, which is a navigation guiding you around the healthcare system company, merged, and then a new company called Transcarent, which is Glenn Tillman, the guy who just sold Livongo for $16 billion. That started with the folks at General Catalyst, just come out of semi-stealth. So we're having a significant, I think, big realignment and growth in the digital health world, and we're going to see how that comes and changes. One of the things that has kind of been done in a half-assed way out of that sort of technology world, which I want to go back to what Anish was talking about and Saurabh was talking about, was the issue around vaccines. And actually, Catalyst Health, the organization like I run with Indu Sabaya, has been running a little sort of RFP for an IPA in upstate New York, trying to help them figure out how to manage vaccine scheduling, and connected to Anish's point, vaccine scheduling is all over the map. I mean, now ZocDoc and Salesforce and all these people are getting involved in it, but it's a mess. You're seeing where there are these big parking lots. I saw a photo on Twitter this morning of the Dodger Stadium in Los Angeles basically being empty, even though there are tons of people who can get there. We are now vaccinating at a pretty high clip, but as I agree with Anish, it's been somewhat chaotic. It doesn't make a lot of sense to me as to why the current healthcare system, which is primary care docs, hospitals, clinics like Anish's and others, haven't been easily found a way to get the vaccines. So, but we are, if you look at us internationally, we're doing a lot, other than the Israelis and the Brits, we're doing a lot better than everybody else. Even though we haven't even approved the AstraZeneca one yet, which I think is...
Matthew, I think I've got an answer to your question, which is that there's tremendous mistrust between those 50 public health agencies and the care systems. Our University of Virginia, went to the Thomas Jefferson Health District, our public health district here in Charlottesville, with a logistical plan to help distribute the vaccines, and the head of the health district just took the paper and tore it up. They didn't even want to talk about it. I think there's a lot of that going on. I think there's just there really isn't, the communication has been not optimal between those 50 agencies that have been, frankly, let's be honest here, starved for funding, starved for legitimacy, starved for leadership. They really have.
I'm interested to hear what. I have some comments on that, but I know Mighty Casey.
Dive in, Anish. I'd love to hear what you think about it.
No, Mighty Casey has a chat here, a commentary. I'm curious for the recipient's perspective.
Well, I mean, I don't want to cut Jeff off because I have seen myself. He and I both live in Virginia, but I've got connections and have heard input from friends and colleagues across the country and around the world about how they're doing this. We are then now. I mean, the whole thing about public sector IT services that are intended to serve the public In other words, give the public information and access to things. The ones that work the best are the ones that make the state money. This is sadly true because of the Grover Norquist effect that we have in all of the public sector, both, local, state, and national, where we, have been battling to get a government small enough we can drown it in the bath. Well, I can give you what the outcome of that is going to be, and it's not going to be happy for anybody who isn't filthy rich. So anyway, cutting all that aside, I have had my first COVID Pfizer, I got the Pfizer first COVID vaccine, had it on Monday. How did I get the appointment? Well, somebody that at least some of you know, Jan Oldenburg, who's a, national level, patient engagement and, IT and, she's all over everywhere in that zone. She moved to Richmond with her husband, I want to say like 6 years ago. And I've been keeping her updated on my personal, the perils of Pauline. I'm being Pauline in that one. And, but anyway, she sent me, at one point we were on the phone and she said, hey, did you get the notification from Bon Secours? And that's where I get my primary care, one of their clinics. And I'm like, no, what notification should I have gotten from Bon Secours? And she said, well, my husband and I get primary care, they're south of the river in a different county. But, we got a notification from them to get into my chart and make an appointment for a vaccine. I'm like, seriously? And I am a patient of Bon Secours. So as soon as I got off the phone, bloop, 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 there I was in my chart. You had to do it through my chart. She sent me the instructions and, did the whole thing, made the appointment and was done in 5 minutes. But Bon Secours is not advertising this. There's only 3 sites where they're actually vaccinating people. There's the one that's out in, out here across the river. And then there's 2 others downtown-ish. And that's all they're doing right now. But that's just pure happenstance. And the fact that I operate in a zone where I have a lot of connections with people, both local and a good buddy of mine is the head of communications for the Richmond Henrico Health District, which is part of the Virginia Department of Health. And he has tried to help me, but even there with that VAMS system that they're using for scheduling vaccines, it's a hot mess. You can't get past the get a password thing.
So this is why, right, and this is why the well-connected are able to get vaccines right now because they have this. There's a spigot, and I don't know for sure whether whether or not there's an overall supply problem. I'm sure it existed in December. I'm sure that's getting better and better. I guarantee you the huge bottleneck now is the public sector that is basically running around trying to allocate this. So, and it's interesting, I hear Jeff talk, and clearly Jeff is steeped in benefits, insurance, expanding coverage, which is really a wonderful thing. But that's kind of the disconnect that I've kind of had as a provider who's sitting on the ground trying to provide care to folks, is that there's this disconnect between getting people coverage, and then it's fine, that's great. But and I'm sure you guys hear this refrain all the time, and it probably annoys everyone, is that, all right, well, what does that mean to me? Okay, great. I'm glad that the percentage of uninsured is going to drop from 30 million to 20 million. But just in this little tiny window that I'm trying to tell you guys about, look, I'm sitting here. I'm in West Philly, which is an underserved area. I'm in North Philly. I'm in a bunch of different underserved areas. I have a large list of folks that are constantly sending me messages about when are we going to get this vaccine? When are we going to get the vaccine? And and I have not been able to get my hands on it. So I think I would love it for the policy folks, or folks like Jeff and others, to spend a lot more time perhaps thinking about not just things from that 1,000-foot level, but how you translate coverage into the actual delivery of care. Because I really think that's where we've really fallen apart. And it's not just for the vaccine. So the vaccine is just the first example of it. Just one example, not the first, one example of it. It's just, it's like meaningless to me that all these people have coverage. It's like, okay, fantastic. I'm happy this ACA vaccinations are happening and people have something when they have some poly trauma and aren't being bankrupted and stuff. I get it. But from on a day-to-day basis, these things are so far removed from the problems that I have. What are people doing about about, taking away the roadblocks that exist for a vaccine that's already paid for us to get it. I mean, I'm sitting here thinking that, look, one of the problems here, I mean, you have an infrastructure that's already built out. Let me just order from my McKesson, whoever I order vaccines from already. Let me just do that instead of trying to set up this other massive thing. And the refrain is never, oh yes, that will make sense because it's pragmatic and workable. The refrain is, well, this is what happens when you dry up public health funding. I was like, look, in order to create an infrastructure that is equivalent to what currently exists to give out the pneumovax and the flu vaccine would require a massive expenditure. And it would require, and what would you do after that was done? Just keep it going for what exactly? So use what you have already. That seems to make sense. Much more sense.
I'll go to Jeff for a second, but I'll point out that we're going to have to figure this out because this isn't one and done, right? We're going to have to do this again next year and the year after and the year after while it's done. But Jeff.
I mean, Anish, I'm with you. During the Medicare for All stuff, maybe a year and a half ago, during the primary, I wrote a piece for Health Affairs blog that no one read about we could get 10 times the actual effect on people's health by doing three things that had nothing to do with coverage expansion. And one of those things was doubling the size of our community health center capability. That is a successful, well-articulated, distributed system. Literally for $6 billion a year, we could cover another 20 million people who would have a place to go to get the vaccine. Do you see what I'm saying? We're not thinking that way. The progressive wing of our political system is all about healthcare as a right. And if we don't cover people, that's the symbolism. We haven't done the job. We've got all these uncovered people. We've got to get them coverage. We build websites that don't work. I mean, we could get a huge amount of benefit out of building on things that work now. And then the other thing, Ian Morrison and I wrote a blog for Health Affairs blog back on the 9th, was published on the 9th of March, that basically said, our private sector care systems and our public sector care systems, like the Health and Hospitals Corporation of New York, have vastly outperformed expectations in this pandemic. And we really ought to encourage our public health officials to use those systems as delivery vehicles instead of building something new that doesn't work with no money. That, Inova, our large health system in Fairfax County, Virginia, is up to 250,000 vaccinations. And they were able to do it because they were organized and they had an information system and they could find people and they had clinic space and people that they could mobilize. There's actually systems there to help do this. And part of what we argued for in that blog was, why doesn't the public sector, under-resourced public health system use these tools to help us through this? And then to figure out collaborative relationships. So apropos of Matthew's comment, the next time this happens, we don't have to fumble around for 6 months or a year and people being like, how do I get vaccinated? We've got the tools to deal with this. What we don't have is the political wisdom and the organizational savvy to make those tools work properly for people.
I just wonder,
we can blame. I want to jump in and blame the government here, and I happen to have a former government official on the line here. So, Lygeia,
I wanted to jump in and say, building on this theme of why don't we use the tools we have? I just want to remind folks, it's not as if we're just powerlessly as consumers and patients sitting here and being like, oh, please give me the vaccine to save the vaccines are wonderful and I am grateful that we have them. But if we would all just wear our masks and do some social distancing, we have within our power the ability to significantly cut back on this pandemic and get it way under control. And the fact that we haven't managed to do that is more depressing to me than the fact that we haven't really mobilized our public health infrastructure. Because I honestly think wearing a mask and avoiding, eating in a restaurant or whatever, these are not hard tasks. This is not run a marathon or, this is not really difficult. I actually feel like it's almost too easy in a sense to wear a mask, you know?
It's
like
true.
you have-
I wear two, and it's easy.
Yeah.
So let me be difficult here for the sake of it. So there are a couple of things that have surprised me in the recent past. I don't know if Anish or Saurabh, you have some data on this or some anecdotes. So my most of my good research happens when I'm skiing these days at Squaw Valley. I sat next to an anesthesiologist on a chairlift who was complaining about his wrist hurting or some joint hurting because he'd had the second Moderna vaccine or whatever. He told me that in his hospital in Redding, California, which is a town in the rural part of California, it's a good Trump country there. And we've had a lot of talk about ideology, about vaccines, ideology about wearing masks. He said that of the hospital staff, 50% had refused the vaccine.
Right.
I don't know. I've heard a similar number of 30% from
you know,
and then I've heard of 30% at UCSF in good liberal San Francisco, and I even in the UK, although the NHS staff, I don't know if you've got any numbers on this, Saurabh, the NHS staff was well over 90%. The care home workers, the sort of the folks who are going into the homes and the care homes were down in the sort of 65-70% range. So we do have this sort of vaccine hesitancy, and then we have the issue that I don't know why hasn't the US, put the AstraZeneca. I don't know if it's because AstraZeneca hasn't gone through, but we're sitting apparently on all of AstraZeneca vaccines that the Canadians want that we haven't that are sitting.
Now we're shipping a bunch of them to Mexico to reduce the pressure on the border.
Well, I mean, because
which I agree with.
We're getting to the point where we have to start thinking about distributing it, and then I want to get us to the part, and we have 20 minutes left in this conversation. I want to get us to the part of like what happens when we are in, we're now at the end of June or whatever. Biden says everyone American will have the ability to have a vaccine by the end of June. So maybe we get past it. We get Anish, his vaccines come. He can start vaccinating his patients and all the rest of it. And then, the parking lot at Dodger Stadium fills up again or whatever. What happens next to, how we're going to live and how this then impacts back on the healthcare system? Do we then have all the people who apparently weren't there doing their elective surgery last year? Do they start coming back? As we already seen that bump? What happens to telehealth? I'd love to have a bit of thought about where we are. But Saurabh, I haven't heard from you for a while, so jump in, please.
Yeah, that's all very interesting, but I don't think the vaccine hesitancy is as much as people are reporting, at least not from what I'm seeing at Penn. The uptake has been near uniform and it hasn't even been mandatory. It's not like the flu where you get notices saying you need to get vaccinated. People are queuing up. In fact, it's appointment only because they're aware that people are applying left, right, and center. The other day, we were in North Philadelphia near Einstein Medical College, and we saw the line for the vaccinations being given out by the Black Doctors Consortium. It was about 500 to 600 people, and they all were from the local neighborhood, so weren't from the rich neighborhoods. So I think reports of vaccine hesitancy are grossly exaggerated, first. Second, it's just become, you talk about political will, but it's not just political will. It's the overthinking that really has seeped American policy. It's the worrying about people jumping the queue rather than worrying about getting the supplies. It's about worrying about the equity rather than worrying about scale. It's just misprioritization and lots of it. And it's taken years and years of practiced overthinking and overanalyzing to get to this particular stage. And I don't know how much of that is political. I think the idea, but it does create these bottlenecks that Anish is talking about. So, for the future you talk about, one of the things that you really need to talk about is scale. How do we get most things to most people all the time without these barriers of overthinkers coming in the way? In terms of, why get vaccinated? To take your bloody masks off. Why take your masks off? To be normal human beings again. I mean, I think if that's not an incentive to get vaccinated, I don't know what the hell it is. For a year, I've been using my mask like I use a toilet paper, right? Well, I guess that's too much information.
Hopefully not the same place.
Yeah, that's a bad image, dude. Yeah, no, bad image.
But the thing is, like, you want to get rid of all of this. I'm amazed by anyone not desperate to get vaccinated, quite frankly, and I'm amazed that people are not looking at this desperation. Instead, we have these
You're not wearing a mask. You're not desperate to get rid of it.
Well, I'm in a little cubicle. And I'm in a little cubicle, and I also don't wear it when I'm alone running because, but I do wear it most of the time. I'm a big proponent of masks. And like you, I recognize that it's common sense for its efficacy, and the people that have started looking at clinical trials, I mean, that's just idiotic. But I do wonder, don't people want to take it off? Don't people want to get back to normal?
Well, we do have this situation.
Haven't people had enough of Zoom?
Well, you know this situation, right, where people are looking at the Florida numbers, looking at the California numbers, and California's on lockdowns and all the rest of it, and Florida's basically, has descended saying, "Come, let it go," and you argue back and forth about all the Florida numbers real, or the California numbers real, and the rest of it, but they're not that different, which has been, I think, the surprising one. And there's obviously a lot of other factors going on about transmission, the where people live,
yeah, but I think
concentration, etc. But
yeah, but the masks are common sense. Arguing about masks, how it ever got to that stage, just it baffles me.
It got very politicized very early on, right?
Comes through breathing will be reduced by wearing a mask. It's bloody common sense. But don't people want to get out of this hellhole? Don't people want to get back to normal? So
it's just to not counter Saurabh, because it's always dangerous, but to just introduce some pragmatism to what Carver was saying. I'm in the business of trying to constantly in the business on a daily basis, maybe 30 or 40 times a day, going to exam rooms to try to get patients to do X, or try to eat better, or to take this medicine for their heart failure, or to take this blood thinner because they have an arrhythmia that without the blood thinner can cause a stroke. And I think long understood that, and I've not been in the vaccine administration business as a cardiologist. So that's a different conversation that I've been having with many of my patients, because many of my patients are obviously some of the highest risk if they were to get COVID. So, part of what I do now is having that conversation with many, many, many patients. And of course, and it's convincing patients. The last blog that I wrote for the healthcare blog was about this conversation of a Texas couple that came in saying, we're going to Texas, we want ivermectin, and this vaccine is bogus, right? And they come in with that front, but how should I come in and approach them? And I know Saurabh wouldn't approach them saying, what the F is wrong with you? Don't you want to get out of this hellhole of wearing masks? And here I'm going to jab you with the needle. But persuading people is probably a much more is challenging given the environment and given the politicization that's occurred, and given the fact that public health figures for the course of the last year, partly because of lots of flip-flopping. I mean, I was wearing a mask March 12th of last year, and my hospital administration person, who's told by his infection control person, is saying, why are you wearing a mask, right? So, you have to feel for, I completely understand vaccine hesitancy in all over the place. And the question is, how do we best approach folks like that? Folks who, the nursing home that I go to, only 30% of the staff have agreed to get a vaccine, and they've had the vaccine available to them since December, right? And there's just, the question is how to go doing that. And I think it's far better to persuade folks with some of the snazzy public health stuff we do. I mean, we persuade people to buy Twinkies 3 times a day. We persuade them to eat Doritos. We persuade them to smoke. Why is it that we haven't had a public health campaign with LeBron James and some stars of the NBA and demographic that's respected by just like we had Elvis, right, getting the polio vaccine. I'm stunned that we just have a bunch of scolds saying this is ridiculous. I'm not saying Saurabh to scold. I'm just saying,
I am a scold.
Saying what the heck? What is wrong with you? Why aren't you getting the vaccine? We need to be smarter.
I agree with you.
I actually have a solution. I have a solution for Anish's clients.
India has no problem vaccinating people with polio. This is a total first world problem. And the more you treat them with kid gloves, the worse this problem is going to be. And I really don't understand that. I am a scold, and this is idiotic. And it is, and you can't just say, please take a vaccine, please take a vaccine. You have to just say, look, don't be an idiot. Take the bloody vaccine.
That's just exactly the wrong way to do it.
I know it is, but that's exactly, there is no other way to do it, because
honestly,
honestly, I'm not going to be persuaded by little data points. You do need to tell people at times that they are being selfish and idiotic.
Yeah,
Because
and that's not going to persuade a lot of people. Even if I agree with you, Saurabh, even if I agree with you, I think we're going to have to respect the fact that they have reasons that probably aren't the right reasons, and we have to treat them substantively. And I'm with Anish. I think we have completely dropped the ball. We have this vast network of social influencers that we could have tapped into to try and reach the demographics that are most skeptical. A lot of those folks have reasons to be skeptical. Look at a lot of Black folks that are thinking back to the Tuskegee Airmen, right? And who are like, medicine is supposed to be good for us, but it wasn't. And we don't.
I can tell you that.
But at the same time, I think the Black community is not being offered vaccine at the level that white communities are.
All right, hold on.
We should shift the skepticism onto the African American community, because that's not true. That is not true. I think a lot of the skepticism comes from communities that haven't historically had this problem. It is very much a first world problem. It is pathology. And yes, maybe the influences here and there could have done it. Yes, maybe if Trump had gotten vaccinated, a lot of people would have done it. Yes, maybe if the public health had been more determined about the vaccine and its efficacy, it would have helped. But ultimately, I think there are enough people waiting to get vaccinated, get them vaccinated, move on, and don't worry too much about the vaccine.
Yeah, but
let me interrupt here. Two things. One is that everyone should read Anish's piece, especially if you're sitting in the waiting room. You shouldn't be allowed into Anish's clinic until you read his paper, and then that'll sort you out. You'll get vaccinated at that point. It's actually it was a great piece about that couple. Second thing is, aren't we now? I mean, I was kind of kidding about this, but when I found out that 25% of Congress hadn't got vaccinated, my guess was that it was pretty much on party lines. We're worried about overcoming the filibuster if you're a Democrat. Well, the way is I said you now don't let them bring their guns in the Congress, right? How about you have to show that if you've been offered the vaccine, you want to go in that public space, a federal building, like say the Capitol building, you can't go in if you haven't been vaccinated. And that would enable the Democrats community to get over the worry about the filibuster, because there wouldn't be enough Republicans to stop them. Kind of kidding, but also, what are we going to do down the path about getting access to federal buildings, going to bars, getting on airlines, going on cruise ships? Are we going to say, well, it's your choice? Or are we going to say, like we do for schools? For most public schools in this country, if you don't have a bunch of vaccines for your kids, you can't go. And in California, we changed it. You can't even have a moral objective. You actually have to have a clinical reason. Yeah. So are we going to go to that? It seems to me that a less
schools
a non-first world
I
problem.
hear you. I kind of
we're gonna have to think
part
about
of me that absolutely likes that approach, and I just wanted to bring up. I think the schools thing is important and complicated as of right now. There isn't a vaccine that is approved for younger kids, so that's kind of an issue. I'm hoping that maybe there will be by the fall. But otherwise, I am kind of concerned about that as a weak point, even though kids don't necessarily get as sick as adults do. We don't really know what the long-term impact is. And so that is definitely a concern. And I know that teachers have had access to vaccines in most areas, but I don't know that they're required to vaccinate.
Well, that comes to me. I don't think you're required where I live. But let's get to the key point. Are we going to say that you cannot perform a whole bunch of
public health
yeah. Saurabh, you mentioned that you had to get the flu vaccine to actually stay working at Penn. Are we going to start seeing organizations like hospitals, like schools, like others, start saying if you don't get vaccinated, you can't come? It's a come to the job.
I think Qantas has already said that they're going to have proof of vaccinations before you board the flight to Australia.
I would say that
I'm not sure how practical that's going to be, but they've already stated that intent, and good for them.
I would say that's counterproductive. I think mandates will be counterproductive. I think my goal is to get as much of the population vaccinated as possible, and as much as I have been in India, and the Indian patient is very, very different than the American patient in terms of deference to the public system and deference to the medical system. There's a huge gap, and the doctor is in many cases regarded as kind of God in many parts of the world, and that is not. Doctors are many pegs down from God in the United States, as
present company accepted, of course.
Yes, exactly, as we probably should be. So, while I agree in maybe philosophically with, well, I don't know if I agree that I think our goals are the same. We want as many people vaccinated as possible. I think mandates would be counterproductive. I think I have disagreed with Saurabh about making it mandatory for kids as well to get the vaccine. I think if the goal is to end the pandemic, we could probably end the pandemic by vaccinating the entire high-risk population without poking the bear, if you will, of mandating school vaccination. Also, the problem, because there's going to be just as I'm not sure how to pronounce your name, Lygeia, is that right? Just as Lygeia was saying that we don't know the long-term effects of COVID in kids. It's going to be very hard to answer the rejoinder to that, which will be, well, we don't know the long-term effects of the vaccine in kids. So it just opens up this whole Pandora's box of things that we probably don't even need to go there, right? I think if
the long-term effects of smallpox when we were giving that vaccine.
Thankfully
to you and to me, that's been eradicated.
So
if you're going to make that statement, then you're going down a very slippery slope.
Right.
And that's going to be dislocated for what's been done in history.
Right. So that's why let's avoid
effects of polio.
Let's avoid
kids rubella, even though kids don't get pregnant.
Let's avoid that debate.
So what I'm saying is that we have to vaccinate as many people as possible, but I think you're diminishing the importance of mandates. Mandates work. Mandates
I just think my belief is,
and even if mandates don't work, if I may, the private sector, since you're a free market believer, the private sector has every right to require immunizations. So I hope you'll join me in defending Qantas's right to require immunizations.
Absolutely.
So let me ask one other question.
Defend their right to do so.
Anish, you said, let's go back to Anish and then we'll go around. We're running short on time, but Anish, you said, we can get there by doing the high risk population. There were some people early on. I mean, Saurabh, you interviewed John Ioannidis, I hope I got his name right, who was talking about, could you not shut down the country, and could you sort of ring fence things like nursing homes and staff who work there? And could you basically pre-vaccine? Could you isolate certain populations, who are clearly most at risk? And we had this conversation back last year when you were on the show, Anish, because we know who was most at risk and who was most at risk from dying, and we didn't do that. Could we have done it? Would it have worked? Who knows? We didn't do that.
Yeah.
We went through this rolling pandemic. Can we, could you literally get to the high risk population and vaccinate them and that be kind of done with it? Or B, can you actually are they in the folks who are the resistant ones? Strikes me that you're working in, maybe Saurabh's right, maybe this isn't a problem, but I've seen a lot of anecdotal evidence about vaccine resistance among healthcare workers. If they're not at high risk, who the hell is? So I don't know if you mean maybe.
I just think I may disagree with Saurabh here in that I think in the United States mandates are going to be are going to be counterproductive. And the other downside, and again with disagreement, I think we will get much farther by persuading people, showing them the evidence. Me sitting down with that couple and saying that, look, in the vaccine arm, there were 0 people in the intensive care unit, meaning there were 0 people that were intubated on a ventilator. In the placebo arm, there were 30. So please, if you want to do something, don't overdose on vitamin D and sunbathe.
I'm amazed that
Anish may want to do. Please take the vaccine. Anyway, I think I'm going to get a lot farther making those type of persuasive arguments than saying, hey, you can't go to Texas and plane. Hold on, let me finish. You can't. So we disagree. We disagree partly because I treat American patients and Saurabh treats fictional Indian ones. But
I treat American doctors.
Hold on. And the second thing that should worry this panel, this panel of wonderful progressives that I have on me today, is that if you do something like what Qantas is doing, guess who is that's going to benefit the most in terms of the ladders of society? It's going to benefit the well-connected who are able to get a vaccine much more so than others. So what are we saying, that only the well-to-do and the folks that are connected to health
people don't want vaccines. If people don't want vaccines, there should be no problems getting the vaccine. If there's vaccine hesitancy, there should be no problem getting it. I mean, Anish, I think if you think that people need data and p-values to convince them, I think you're being extraordinarily naive.
No, I didn't.
That is not what convinces people that MMR is not associated with autism. It's a belief system and it's entrenched, and there's nothing you can do to shake that. And you might not know that because you give people antihypertensives rather than vaccinations. But once you do that, you might come to the realization that, and I know that it offends your little libertarian, you tell a libertarian, have a vaccination. You say, oh, for the public good. Oh, no, we can't do that. It's a slippery slope argument. No. If you have a mandate, more people will get it. That's the whole point of mandates. You mandate a mask, more people will wear it. You say to a patient, you cannot enter a restaurant until you have a mask, then people will enter a restaurant only when they have a mask. This is common sense. You can't say to people, do whatever you want, here's some information, and let's have shared decision-making. But in any case, I think that's going very far down the line. Matthew's question really was, do we need herd immunity to reopen the economy? And I think I might be in agreement with Anish here, although he hasn't quite said it. I don't think so.
Yeah, no, I think schools should be open. We don't need. Yeah, I think schools. There's a bunch of different places that we should be able to open. But guys, beyond all of this stuff, right? These are all great conversations to have. Like, please, somebody help me get the freaking vaccine. Like, we're talking about the world and stuff, and like literally, we should not have a process like this. We should be. Yes, I know we're better than Germany or whatever. Look, the convention center was just taken over. Just 3 weeks ago, FEMA came over and took over the Philadelphia Convention Center in order to try to get the vaccine out faster and in a better way. They have 6,000 vaccine doses a day to give out. Right. Immediately, soon after this was announced, it was also announced that 3,000 of those vaccines will only be given out to people from these certain zip codes. And I understand it and I get it, but it's a complex problem. You're dealing with vaccine hesitancy in those demographics. It really needs to be a multi-pronged approach to try to get folks to get more vaccine, right? So until you do, please vaccinate everyone and their mom as much as you can, because we are going to be able to open up and take off the masks, do way more if we get everyone over 65 vaccinated, right? And then, that'll be a much better place to sit in and then have these somewhat esoteric discussions about, can I fly to Turks and Caicos on Qantas? It's like, okay.
And if Qantas doesn't go to
I'm not sure they go there. All right, and at that point, we're at the end of our hour. It's been a really fun discussion. I'm going to want us to go around real quick about what we're expecting and looking for, hoping for in the next week, couple of weeks, few weeks, but we're at time, so let's make this a real lightning round. Okay, Jeff.
Yeah, I mean, I listened to all this stuff and I'm thinking about the Chinese and the Japanese and the South Koreans looking at us and going, those Americans really have frickin' lost it. This is what a failed state looks like, guys. That's my comment.
Casey.
Yeah, I agree with the failed state thing. I would like to see the vaccine push and the ability to sign up for vaccines put more in the hands of the retail partners that the federal government has contracts with, i.e., CVS, Walgreens, there's various supermarket chains with pharmacies, because that is starting to happen a bit. And I think taking it out of the public sector's hands right now is how we will save Americans from COVID. It won't happen because the State Department of Health did it.
All right. Anish.
Yeah, I can't. That's a wonderful segue because I cannot agree enough. I think, unfortunately, the public sector is overwhelmed and not ready for this type of job. And I think we really have to use the infrastructure we have to get the vaccine out as fast as possible to as many groups as possible. We need to be smarter about it. We need to utilize our influencers to get to communities that have vaccine hesitancy. And I think that is our path to where me and Saurabh both want to go, which is, sitting in a bar next to each other, drinking old fashions. So
well, I'll come join you. Saurabh.
Yeah, going on Jeff's point, South Koreans are probably laughing at us, but probably laughing harder at the Italians. So fate could have dealt a more severe blow. It's not as bad as it could be.
Right. Lygeia finishes up here.
So as I look at this problem and I look at how badly I feel like we've bungled it from certainly a messaging and compliance perspective with mask wearing, I am concerned because, as I said, I don't think mask wearing, although it's a drag, it's not that hard. And there's really clear evidence that it makes a difference. It bothers me that there are a lot thornier other issues related to healthcare and beyond. Like, how do you use artificial intelligence? What do you do with genetic engineering? All kinds of other things that are so much murkier. And if we can't agree to like wear a mask, I'm worried about what that portends for these other things. So that's one thought. Oh, maybe we're off. Okay, the final thing.
No, we're not off.
Oh.
I'm just prepping to leave. Sorry. Give me a second,
Okay.
Paul.
I am also super excited to see my own in-laws who are fully vaccinated and have been waiting for this for a year. So looking forward to that.
All right, fantastic. Well, I may have jumped the gun there a second there, but I want to thank my guests for this week on THCB Gang. That was the closest we've come yet to a good Indian political discussion like they have on the cable channel.
It almost turned into an Irish discussion.
Everyone's shouting at each other the way I like it. Okay,
Lygeia just said, looking forward to seeing her in-laws. The best thing about this pandemic is I haven't had to see my in-laws for a good year.
We better hope they're not watching this show, so we're in real trouble. All right, my guests today were Jeff Goldsmith from Charlottesville, Virginia, Lygeia Ricciardi from DC, Casey Quinlan from Richmond, Virginia, Saurabh Jha and Anish Koka, both physicians. Don't always agree with each other, but can drink their old fashions together hopefully soon, from Philadelphia. I'm Matthew Holt, the founder and publisher of THCB Gang, saying thanks for watching THCB Gang. Whether you're watching live or listening on the podcast, it's the March 18th edition. Next week, we'll be back at a different time. Look out for that. I have something else going on at 1 o'clock that I have to do. But look forward to seeing you all, and thanks for listening.